Athens. Today, March 25th, 2020, your daily COVID-19 update. I'm your city manager, Seth Sumner here, and with me is Mr. John McLain, the CEO of Starr Regional Medical Center, to share with you some messages about our local hospital system and their approach to helping us with this COVID-19 issue that we're facing. I did want to update you with the numbers that we're seeing live from the Department of Health, as well as private and commercial facilities that are testing for the coronavirus now. There have been just shy of 12,000 tests conducted statewide. And today, this Wednesday, we are seeing 784 cases of coronavirus in Tennessee, which is up slightly from yesterday's 667. Now, good news for the third day in a row is here in McLain County, we still only have 2 cases. Those 2 cases were identified early on, properly tested by our healthcare community, and all of the proper procedures have been handled as far as quarantining those individuals, and they are recovering well in the safety and security of their own home. Now, a lot of people are asking about where have these people been? Have I been in contact with them? And we hope I've been able to answer those questions for you. But again, I want to share with you, there is a specific team in place that is working with every COVID-19 positive person across the state of Tennessee to trace their steps, to identify the places and the people with whom they've been in contact. Now, as they identify them, the health department is getting in contact with those businesses and those persons to let them know that there is a possible exposure. So if the Department of Health is calling, answer the call and see what they have to say, and otherwise you shouldn't have anything to worry about. And so that's how we protect a patient's privacy and find out if there's a risk that we have been exposed. So we appreciate that approach. Some other information I wanted to share with you today, that being that our schools in McLain County, Athens City Schools, Etowah, everyone in our area, schools have been extended out until April 24th. So that will be a long spring break for our kids. Yesterday, Governor Lee mobilized the Tennessee National Guard to help with 35 remote assessment centers. He also extended the deadline for franchise and excise taxes. Those now will not be due until July 15th to help our small businesses. He also is prohibiting utility cutoffs during this emergency. There have been a lot of questions about salons and barber shops, and I would like to read, because this was just posted a few minutes ago. We did go through our health department and ran it all the way to the state, to the governor's office, to make sure that we're getting clarification to get the good news and answer your questions back to you. And so let me read this, and this was just published a few minutes ago, regarding cosmetology and barber licensees. So barbershop, salons, businesses of that nature. Governor Lee's Executive Order number 17, which happened a few days ago, requires cosmetology and barber businesses to abide by the President's coronavirus guidelines for America, as well as guidance from the CDC. This guidance advises against social gatherings of 10 or more people and states the best way to prevent infection is to avoid being exposed to the virus by avoiding close, direct contact with others by maintaining a distance of at least 6 feet between yourself and other people. We do know that there are some cities and counties that may have taken an extra step to close down those businesses. What we're continuing to ask is for people to be mindful, one, of your own livelihood, and most of all, that you're acting in accordance with the CDC and White House guidelines and those wishes of our governor to keep a safe distance from people and make sure that we're doing the best thing that we can to protect the public health. So with those updates, I do want to have Mr. John McLain with Starr Regional share a message with you and give an update about how our medical community is helping the response here locally in Athens and McLain County.
Thank you, Seth. I wanted to take a moment to thank you and the county leadership for the way y'all stood up and made sure that we're responding appropriately. I want to thank my board, staff, and physicians on the way they've stood up in this fight against the coronavirus. Our mission at Starr Regional is to make our communities healthier, and we're doing everything we can to protect the health and safety of everyone that's inside of our doors. And that begins with continuing to work with the Department of Health, Tennessee Department of Health, and follow the CDC guidelines associated with those, so that all of our clinical and non-clinical teams that are in place to help care for patients in our community are protected, as well as, of course, anyone that comes in our doors. We have the ability to detect and protect and respond to the virus. We've been preparing for several weeks for the COVID-19 virus and have a robust emergency operations plan that we have put in place. And in particular, in this situation with COVID-19, our response has really been also to implement preparedness in a way that minimizes the risk of exposure and illnesses to patients and visitors in any way that we can, which is why we've implemented a few things at the hospital that have been put in place to minimize that risk. So in two areas, I'd say, visitation policy and entry points into the community, and then screening associated with those entry points. So we have moved to a zero visitation policy at both of our Athens and Etowah campuses, and all of the other facilities within our organization where we treat outpatients. And the reason we have gone that route is obviously to decrease any contact we can with additional people that may have been exposed through the community or other ways. We want to make sure we protect everybody possible. And that zero visitation policy has some exceptions to it for certain cases, obstetrical patients, surgical patients that need that preoperative and postoperative support from their caregivers, and as well as pediatric patients, and those that are receiving end-of-life care. We believe we need to show compassion and make sure that those types of situations do need another person and should have another person with them. And we also address other cases and exceptions on a case-by-case basis, but our folks are being very disciplined about that policy to protect the patients and visitors and the staff that we have as well, and caregivers. We've limited entry points into our hospitals with just 2 entry points. That way we can have a very very disciplined screening process. So we're going to screen according to the CDC guidelines. When you come into our facility, you can expect to be asked if you have any respiratory symptoms or have any travel into risk areas. And so if you show any symptoms for that, you wouldn't be permitted to visit. If you're there for care, then we will mask you, place a mask on you, and get you to the area where you're receiving care from. So we're doing.
If I can interject, I know there's been some commentary in the public about testing, and early on it was whether we had the test, and we've had the test. We have been testing. That is going on. There is, I think, coming from the healthcare community that there doesn't appear to be a need for widespread testing at this point. We're focusing those tests on patients who have the listed symptoms, and then base that on whether their risk factor. Have they Have they traveled extensively? Have they been on an airplane recently? You know, have they been to a hot spot where this virus is more widespread than it is here?
Seth, you're right on. I know you addressed this in some of your previous communications, and that's absolutely right. The hospital and some providers in the community do have testing capabilities. We have an ample number of tests. But Seth, you're exactly right. We want to make sure that we're testing those people that are exhibiting symptoms and have those risk factors under, where they've been to travel in areas where they may have been exposed to it, or maybe they've been exposed to someone who has been tested and is a probable candidate for COVID-19. Those that come in with those symptoms, those are the patients that your provider, your physician, is going to make sure that you get the appropriate testing. But we do ask that you contact your provider. If you're exhibiting symptoms or have symptoms, contact them and they'll assess your symptoms and make sure that if you need a test, we're here to provide that test for you. And I guess that also will lead me to say the safe distancing that we've put into place in our community and the communities across the nation is I think essential, not only for that safe distancing, but also constantly washing hands, using the alcohol with your hand sanitizer. Make sure you're cleaning surfaces that you may commonly touch. So at Starr Regional, we also have posted a lot of resources on our website, starregional.com, so that it will link you to CDC guidelines, to testing places and how we conduct those tests. And it'll also give you information about services that we're providing. Governor Lee came out with some executive orders around what elective procedures and testing and surgeries can be done right now, and those are limited to urgent and emergent cases. And I want to just let you know that absolutely we are here and ready to go. Our staff is doing a wonderful job implementing all the best infectious control practices, and it is safe to come and get those urgent and emergent procedures at our hospital. We are laser focused on it, and our staff is doing all the right things in this situation. So, those elective situations, where you're not sure if that service is going to be provided right now, have that conversation with your physician or who has ordered that test or procedure with you, and they'll determine the best course for the treatment or procedure that you're scheduled for. And if that physician, we really depend on them for their expertise and clinical judgment to say, yes, that patient needs that test now or needs that procedure now, and we're ready to be there for you.
Wonderful.
Starr Regional exists purely to help our communities stay and become healthier, and that's what we're endeavoring to do in all of our efforts right now.
Wonderful. Thank you very much for that update, John. A few other items I wanted to share with our folks out there in the community coming from the state of Tennessee is that financial aid is now being made available for certain families that have lost employment due to COVID-19. That we have state departments appealing to retirees and master's program students that meet potential workforce needs. They're needing your help. So if you are a retiree or in a master's program and maybe you don't have your degree yet, there are some workforce needs, especially through the Department of Children's Services and Mental Health and Substance Abuse. They're going to need your help. There also has been a partnership between PBS and the Department of Education to help deliver daily educational instructional content for Tennessee students. And so there's a lot of folks are just coming out of the woodworks with giving from the bottom of their heart. We've seen even Disney movies released early. to help those that have children at home. And so a lot of resources are going into helping our folks who are out of work right now, the children that are at home right now, to make sure that good resources are there to help our parents and families continue during the days and weeks ahead as we can get through this, and hopefully without too many more positive cases here in McLain County.
Seth, if I may jump on, you mentioned something that just kind of turned a light on for me, is that you mentioned people giving of themselves, and in the healthcare industry, one thing we are wrestling with is the high need for different personal protective equipment, N95 masks, procedure masks, gowns, and we have seen many people step forward and offer those where they have them in there, either in their retail shop or actually also Harbor Freight has offered this across the nation. Sloan's and Etowah has offered it to us. There are retailers in our community that find that they have those supplies and they know we have a need and they're giving those. So certainly those that have it, we will take those and accept those, but we want to thank those that have stepped up to do that. People truly are giving, and it just says a lot about the community we live in.
Yes, sir. It is a wonderful community. We're very proud to be Athenians and McLain Countyans. And I want to emphasize that what I hope we're seeing is that the social distancing that you're all doing is working. And that's why there still is only 2 positive cases in McMinn, and those people are recovering. Now, what I didn't mention in the numbers before is that we have now, unfortunately, seen Tennessee's 3rd death from the coronavirus. And so we have to keep those families and people in our heart and keep them lifted up because those numbers will likely increase in the days ahead. Keep the social distancing going, folks, and keep giving. It's making a world of difference in fighting the coronavirus. Finally, I do know that you have some technical questions that I'm not prepared to answer. I'm the city manager. I'm doing this as a service to our citizens to help keep you informed daily about some of the updates and the things that are going on. Of course, continue to visit tn.gov to stay updated with news briefings, what the governor's office is putting out, as well as the departments, the resources that they have that may affect you or a loved one. And also, you have some questions that may be more technical in nature as to the Department of Health, and I wanted to share their hotline with you in case they may be of service. And that number is 877-857-2945. And that again is the Department of Health call center, especially set up to handle COVID-19 questions. Again, I'll share that with you, 877-857-2945. So we will be back here with you tomorrow and provide another update to keep you informed. And if there's anything else that we can do to be of service to you, please call your friendly city. We're here at your service. Thank you, John, for being with us today.
Thanks for having me, Seth. Wonderful
message, and I really appreciate everything that our healthcare community is doing to help keep this virus at bay.
You bet.
With that, may God bless you, and may God bless Athens.